Happy Wednesday, everyone. Wow, Wednesday comes awful quick. So glad to be on another AMC Connects episode. We do have a episode with some pretty important topics. Hopefully they all are, but as always, we'll have important topics. We will have some levity and come back to center maybe on the even line. So I'm really grateful to be able to be with everybody again. And like I said, I don't know about all of you. We've made it above 20 degrees. So the last week has been some good weather. Hopefully people are enjoying that. In terms of topics today, we do have some political topics to go over and looking forward to people leaning into those because they're really important and they do need advocacy. We also have a real special guest, and I know I always say that all of our guests are special, but they are uniquely special. And our one today is one that's looping back around. So it's somebody who's been with us before and is back, and I'm very excited. So please stay with me. Welcome back, everyone. Thank you for staying with me. Want to make sure that we are going over some of those really important topics in healthcare that interface with the community. Nearly everything does. We'll talk about that on this particular episode quite a bit. I hope everybody enjoyed last week's episode. If you didn't, we did have the boss. We had the big boss on. People may think that with my role that I get to serve in, that it's a boss, but we had the big one on. And so if you haven't tuned in to that particular episode, it's a little lengthy, but I think really worthwhile. We talk about why a board exists, how the board really evaluates what's going on in the organization, largely through the competencies and the accountability of the role of CEO, and then just getting to know Dr. Estivo a little deeper in some fun and important ways. What an amazing leader. So if you haven't yet tuned into last week, please do so. Well, kicking us off with a real important topic, we did send out, and I've had quite a few conversations with elected officials over the last several weeks. Thankfully, I share this quite a bit. We're really blessed in Oneida County and across central New York to have good people who serve as elected officials. And politics has certainly always been challenging, but a season such as this, especially as it applies to healthcare, has a lot of challenges and needs associated with it. So I'll do kind of an overarching thank you to our elected officials for caring about healthcare and carving out some time for me and others. An important topic that I think has been talked about, maybe subtly in and throughout some publications, but we did send to nearly all of our elected officials that could have ties with Rome Health that we have a serious topic on our hands when it comes to the visa situation. We do have physicians and clinicians and really support staff who work with us on a visa. There are some that are coming down to the wire and just wanted to go over staying in line with what the workforce has asked from me and the community. When I know something, you'll know something. And so this is a really important topic, and I'll just give a briefing. On behalf of the medical staff of Rome Health, I respectfully request assistance in expediting the H-1B visa applications for 2 physicians who are essential to maintaining access to critical medical services in our region. We have 2 physicians that, as I shared, it's coming down to the wire. So thankfully, the Medical Executive Committee and our president of the medical staff, Dr. Bushnell, has formed a letter to help make sure that we have advocacy at every level. The specialists filed their H-1B renewals nearly a year ago, and the 240-day grace period expires April 2026. If not expedited, the delay in processing the H-1B extension will disrupt patient care for sure. Here at Rome Health, we've had, like I said, a number of individuals. These 2, one in particular, has been with us nearly 7 years and just a vital part of our overall team and access to the community. My thanks to Congressman Mannion for hearing this out and helping us with some paperwork, Dr. Andrade, who's working hard, and then certainly these 2 physicians who are doing everything and all that's asked of them to make sure that they stay here at Rome Health in our community to continue to serve all of you, all of our patients. As president of the Rome Health medical staff, Dr. Bushnell says it cannot overstate the impact their loss would be on the hospital and the community. community. Recruiting physicians to rural areas is extraordinarily challenging, and the disruption to these care services and the specialists with which these physicians reside would have immediate consequences for patient access to care. These physicians have demonstrated their commitment to this region by recently purchasing a home in the area and becoming active members of our community. We respectfully ask that you lend your support in any way possible to help expedite visa applications so these dedicated physicians can remain in our community and continue providing care to the patients who rely on them. Thank you for hearing us out, and thank you to Dr. Bushnell and our medical staff and to the physicians working through this process for your patients. Again, we're working very hard and very diligently all the way around, and certainly crossing our fingers and making sure that all smooths out. The topic is a very important topic, I think, all the way around for humanity's sake, but certainly as it comes to access to care, as that letter summarized, as I summarized the letter in terms of rural health communities. Another really important topic that we've talked quite a bit about on AMC Connects is the challenges ahead in terms of our overall financial position for community-based healthcare. Again, across New York State, certainly upstate New York, but there are a number of areas that we've been working on for some time that reside in some outstanding kind of grants that we've been waiting for. One such grant needs advocacy. We did get an opportunity to send out to all the elected officials, but particularly Chairman Garbarino. I believe that is a congressman from the Long Island area. And just a brief note to keep everybody up to date. We want to sincerely thank you for your successful advocacy as chairman of the House Committee on Homeland Security to help release more than $2 billion in long-delayed FEMA emergency reimbursements to hospitals. Those funds represent critical relief for providers that served in the front lines, like we did, during COVID-19 public health emergency, and your leadership ensured that long-standing obligations were finally honored. While we are deeply encouraged by this progress, Rome Health and other hospitals across the United States did not benefit from this most recent round of obligated funds. Instead, we are among a separate group of hospitals whose claims remain in limbo due to FEMA's retroactive policy change regarding duplication of benefits, basically some shifts in methodologies to be able to gain access to those funds. And Rome Health was certainly leaders in terms of forming applications, thanks always to Cassie Winter and certainly Nate Smith and our finance team for always being up front and out in front of pathways to be able to garner funds. And we're at this point where we're kind of caught in the middle and requesting a lot of help to be able to advocate for Rome Health to receive those outstanding funds. We've been in an appeal process, in summary, has been formally submitted by the New York State Division of Homeland Security and Emergency Services with a recommendation for approval. And all materials were uploaded recently to FEMA's grants portal in actually December of 2025. Right now, we are in a 90-day window during FEMA may request additional information, which will be prepared to submit that matter of technical review to render a decision. So again, I'm thankful for this particular pathway to keep us all up to date, included, and involved. But these particular funds would go directly tied to outstanding payments that we've been working with many stakeholder groups on to work with payments that are directly tied to those years we stayed open and accessible to the community and the region during the COVID pandemic. So certainly my thanks to stakeholder groups that continue to work with Rome Health on payments that are outstanding from that time period. But again, really looking forward to be able to receive these funds to go a long way in offsetting some of our aged financial situations. So I hope people feel up to date with that. Another important topic to launch into, and I think I've shared a couple times, Chuck has as well, not that we've gotten a lot of activity through the mailbag, everyone, but we've expanded the mailbag feedback to different other pathways of feedback, whether they're discussions in the community, whether it's Facebook or other social media inquiries or letters. One such one I saw this week, actually, we were celebrating and seeing pictures of the gala all over different people's social media inquiries, and it was just a beautiful event. We'll talk about that at the end of the episode. It was just wonderful. Kudos to the foundation. There I am, Chuck. I'm going deep already. We'll wait. AnneMarie, hold the excitement back. On an important topic, I was reading in some of the postings that there was a particular community member and a few others that said, well, this seems like it's a nice event. I'm paraphrasing here. It seems like a nice event, good for Rome Health and people being a part of that, but what about access to care? There's turnover. You can't get in to see some services, particularly primary care, for long periods of time, and what's happening about that. Again, I'm paraphrasing there. Some people were pretty direct in their comments. And we are doing a number of things to make sure that we are open and accessible in a timely manner to our community and all of our services, particularly primary care. I think I had shared that is certainly a top number one priority for the Board of Trustees to make sure that we continue to stabilize primary care. Difficult specialty across the state and across the nation for a variety of different reasons. But I did want to summarize some things to explain to that particular writer on the Facebook that retention challenges for doctors and advanced practice providers stem from high burnout rates. This is in the literature. Really higher than 50% of some retention rates, intense administrative burdens, and for APPs, compensation and scope of practice issues. The American Medical Association links poor retention into insufficient staff, notes that 58% of physicians considered leaving their jobs. Key drivers include, in addition to retirements, high pressure environments for productivity, and a lack of organizational support. Key retention challenges that were highlighted in the literature, burnout and mental health challenges. So our community and our workforce may not realize that, yes, even our doctors and our advanced practice clinicians do have heavy burdens and they weigh on them at times. And that's something that is an item that we need to work on across the healthcare workforce. But administrative burdens, or what the literature called bureaucracy, or EHR work, kind of almost being a slave to some of the ability to capture information and documentation efforts. Compensation disparities, there's certainly a wide range of how organizations and jobs compensate physicians and APPs. Lack of autonomy or scope limitations. We want to take maybe care of patients at a certain level, but there's challenges associated to do that depending on the licensure one may have. Ineffective integration or poor orientation or lack of understanding of certain roles. Retirement waves. We had a huge retirement wave across the nation during and post-COVID, and we're still living and working through that, and that applies to Rome Health as well. High competition, especially in the primary care realm, but certainly a number of specialties, OBGYN, GYN care overall, women's health. There's a medical imaging, thinking back to Dr. Estivo being on the podcast last week. There are a number of specialties that have lots of challenges in terms of recruitment. Consequences of low retention can certainly be a financial impact, patient disruption, which I think this particular member of the community was highlighting, operational strain. Strategies to improve. And I was really thankful of this and doing this lit review after seeing that particular comment, because nearly every strategy to improve we are working on here at Rome Health. Focus on culture. Working hard to make sure that our whole workforce, our doctors and APPs included, really understand that everybody's essential to what we do. And so making sure that we cultivate an environment that addresses burnout and appreciation, professional development, and encourages open communication. Support staffing. Making sure that we have all of our workforce that are practicing at the highest level of their competency or scope of practice, so that that can support physicians and APPs to do all that they can do. Competitive pay. We're not perfect in this category, but working hard to make sure that we have competitive salaries that we can recruit and retain. And then optimizing workflows. We're doing a number of different activities on every single one of those fronts. So I wanted to assure the community that I do hear and see what's going on in terms of social media, questions that might come through, because again, the mailbag's been a little quiet, people. We want to make sure that you can use the mailbag. I know Chuck does a great job of flashing that up. Get to the mailbag. Ask your questions, concerns, or pose them. But no, I am certainly looking. I'm looking out there to make sure that we always get feedback in a variety of different ways for Rome Health. Please know we're working hard, I think tirelessly, to make sure that we have open and accessible access points for everybody that needs care, because we want to take care of you. in a wonderful, safe way. Well, that is a great segue into, if you were thinking in the back of your head, AnnMarie, is your introduction and topics going to last forever? Or do we get
Never.
to meet? Yes, no, never.
No
Okay,
one thinks
good.
that.
Thank you, Chuck. Thank you. That guest, that's a repeat guest. You may not recognize him. I'll be honest. You may not. Because the last time this particular guest was on, they were in their full form. Okay. If you're thinking in the back of your head, what's your guess? What is your guess of who this guest is?
I think we need to take a
We're
look at
talking
that.
about, we need to take a look at that. Chuck,
Let's take a quick look
Chuck,
at that.
show the audience. So I wanted to make sure I emphasize that, but Chuck, I think I'm hearing something.
What is going on?
I'm hearing some
I don't-
knocking.
What?
I don't know
Wait,
what's
well, wait, what is this? What is going? Hello? Can we help you? What is going on?
Whoa! What do we have here?
Well, hello.
What?
Hello.
And
Chuck,
what is this?
What is happening? What is happening right now? I think maybe some friends
But you tell me. I don't know what's going on.
to help us talk about the very important circumstance of falls prevention. When I first came to, I can't even. So when I first came to Rome Health, I had realized our highest injury rate for employees was falls outside. Because of our weather, because of some of the challenges with our infrastructure and our surface areas. And here we are joined by two important, I don't know if people recognize who these two people are yet, but
Well, hello, Ryan.
Ryan, can you bring your mic in just a little? There we go. Yes.
nice.
Perfect.
Nice.
Thank you.
Well, when I had started to talk to the organization a little bit about this, we had some champions that kept saying, we have to walk like penguins to make sure that we don't fall. Scott, what is this?
Well, I think that there's no better way to show people how to walk than become a penguin.
We have to pause because maybe people didn't recognize that it was you.
Yeah. So, well, yes, I would hope that I can't see why anybody wouldn't recognize that Chief Quality Officer, along with our lovely Chief Operating Officer, recognizing that no better way than to actually be a penguin.
Yeah, I mean, right. Well, what do people say? When you get out of the car in the winter and you're walking to the door, how should you walk?
Gosh, for the listening audience, that was a picture of this guest and their fine form, which was a penguin. With us today, everybody, without further ado, is Scott Burns, our Chief Quality Officer.
Well, good afternoon, everybody. And I must say, I appreciate not being in uniform today.
Yeah.
I'm kind of disappointed.
But I will start off with saying I think the penguin suit helped. Because in review, we did have some minor slips, trips, and falls throughout the course of this winter, which was difficult. I mean, total of 12, but no major injury. And most importantly, I want to really give a thanks to our plant operations team, building services, because it is not easy in upstate New York to keep our sidewalks. And, I think that the heated sidewalks obviously were a huge help.
Yeah, we're pushing those.
But again, it adds more water, right?
Yeah.
So when it gets cold, so I think that the salting, they did a really, really good job. So again, we did have 12 injuries, but my last appearance on AMC Connects was definitely geared towards employee and patient safety with walking and, kind of, I know that it was a little comical, but the truth is it really is important. And we survived. We survived, yet I liked your conversation earlier around weather changing. I think all of us are ready to put the shovels away and pull out the clubs or whatever it is that you do in the summer.
Yeah.
So I'm ready. But all in all, I think that the patient safety group, and I'd hate to, kind of segue it in, but let's recognize that we were first in the nation to receive something. Safe patient handling, seal of excellence. I think that the hospital team
Have you been watching
recognized
AMC
quickly.
Connects or listening to AMC Connects?
I
Scotty?
actually
Let's
save
be
it.
honest.
I save it for a rainy day, and we haven't had one yet.
Okay.
Like today.
I've watched
Because-
a couple, but I think I might watch a few when I get done today.
Because, we need to hear it again for sure because it's such a major accomplishment. But rumor has it that was on a recent AMC Connects, that we were announcing that particular, first in the nation.
First in the nation.
First and only,
Pretty
right
impressive.
here at Rome Health, Scotty.
Boom, baby.
Right here.
And, there was actually the day after that posting went out, we had a patient that actually came specifically because of their condition and recognized that they wanted to be at Rome Health because of the fact that they knew that we had the safety equipment and the teams and policies in place to make sure that we were going to keep them safe during their stay. So, you think about these little accolades, but there are unintended benefits sometimes beyond just a piece of paper.
Yes.
It really is letting our community know that, we worry about our employee safety.
Yes.
As well as making sure that we are actually, but the safe patient handling seal of excellence, first in the nation. I was away at a conference last week and was able to do a phone interview with the folks that were here on site from, and it was so humbling to see how our team worked through that. I'm very proud of them.
Yeah, we should be. Because I think what I heard from those surveyors of that particular designation is what was remarkable for them is that particular emphasis on safety for our employees and therefore our patients is so key here. Like, it's in the fabric of our employees. Like, our employees are leading the way versus it being kind of pushed by you or pushed by others. It's our employees that have really embraced this as a major emphasis for our, and that was palpable for them.
It was amazing. It was a great article.
Scotty,
I was excited.
Congratulations to our quality management team and our whole organization, and to you to really emphasize this, because it's a pretty rigorous process. I think I shared on AMC Connects. I think I shared on AMC Connects that people didn't even qualify to apply. Tell us a little bit more about that.
So yeah, the application process was quite rigorous, and there would be some things that had to be set in place that we had already had, because we've worked hard before, but never really had the opportunity to kind of show all that we do.
Yeah.
So I think that the fact that Rome Health was one, even able to apply.
Yeah.
But secondly, the accolades that we received from them post was really unsought. Like, they didn't need to tell us. They had already given us it. But their additional feedback was really heartwarming.
It's like they didn't want to leave.
We'll welcome them back.
Right. I know. They didn't want to leave. They just want to keep staying.
So when
and
we
sharing.
start getting those calls of, how'd you do it?
Yeah.
To be able to share that with other institutions and is great.
Yeah.
And I mean, really, I can single out several different people, but it does take the village. And really, really, really proud of the team.
Yeah.
Because being first in the nation in anything is pretty exciting, but to have it happen at Rome, New York was very special.
Thank you, Scott, for that leadership. It's great. Well, you mentioned it, but you were away. It was officially announced on AMC Connects and to the community, our Regional Health Stabilization Technical Assistant Grant. So we talked about it here, everyone, as soon as I had heard about it. When I know, you know. But we were able to officially announce it to the community and outside the organization. And Cassie and I thought about this. We really kind of slaved over the decision of who would be our community champion, and it was announced, and we're so proud that Scott Burns accepted the initial ask and the tall ask to be able to blaze a trail that I don't know a lot about, and none of us know a lot about, because this is brand new. We're only the second cohort in this particular path, and so Scott jumped right in, as he always does. And Scott, take it from there. Tell us a little bit more about what you learned.
It was a pretty intense, community engagement champion, CEC, because we know in healthcare we love our acronyms.
We do.
And because I'll go down HRSA, but to give a background for those of you like me that haven't listened to all of the AMC Connects, recognize that we were one of 8 in the country to receive this stabilization grant through the centers. So I had spent several days, really intense days around really how to better engage, and gave some tools and tricks around really how to work with the community on, the premise of this community engagement champion role is ultimately to be the liaison between the community and the hospital.
Yeah.
So in some cases, the other 7, hospitals that are achieved, they may have been a community member that they hired for this role. There may have been somebody in marketing that they already had for the role. So it is an eclectic group, but the focus of the conference really was, I like call it a conference. They call it a boot camp. I now understand why they call it a boot camp.
You said you could barely breathe.
It was, you picked up your phone, you had somebody looking at you, you're doing something wrong. So
yes.
No, it was 10-hour days, and I mean, when I tell you, they were regimented. But it really was a great experience. Got to meet the others that are in the Delta program, as well as the 8 that actually, we were one of for the stabilization. But this is again through HRSA. These are federally funded dollars that allow us to really kind of how do we stabilize and sustain rural healthcare.
Awesome.
And I think the definition of rural healthcare is pretty broad, right?
Yeah.
So we do qualify in many ways. So the nice thing is that to get these hospitals together and recognize that we all have opportunities to engage our community and better serve them.
Yeah.
I mean, when you think about our mission and vision statement alone, at the end of the day, everything has to come back to that. We want a healthier community, but we need to know what that community wants. So you were reading some testimonials around, and that is what the biggest excitement for me is the testimonial concept.
Yeah.
I think we do a good job, but I learned so many opportunities that we aren't taking advantage of, and that's really going to where people are after they get a chance to leave us.
Yes.
Right? So, and working with some other groups that maybe don't have a full understanding of all the services that we provide. We have large, brand new employers that are coming on to our Griffiths Technology Park. We want to make certain that those folks know what we have to offer for them and know what their needs are, so that if we don't have it, we can continue to think about additional service lines or expansion of existing ones.
Awesome.
So some of the things that they had done, though, were a little cumbersome for me initially, not natural. Flip charts and certain types of process of action planning. A lot of work around focused conversations.
Yep.
Some might hear it as ORID, which is it's a unique way of having a structured conversation.
Yep.
It's going to feel a little clunky for me, so I'm going to be trialing that out on a few people. 2 of them happen to be in this room. But the good thing is that ultimately
What?
One?
What? One?
You're
What?
2.
Are you the
got
2?
it. No, you're the 2, because I get to actually do the focused conversation.
Oh, boy.
So ultimately, it does, though. It really is about objective. There's some
Yeah.
objective questions that kind of lead with the topic that you want to get in. That
Yeah.
gets the buy-in, and then you have the reflective portion of it, which allows them to kind of tell you what they feel about it.
Nice.
And then you get into kind of the interpretive, like what do we really need to make sure that we're doing,
Awesome.
and then the decisional. So that ORID, ORID, is kind of the acronym that a focused conversation uses. It's kind of tried and true.
And this is supposed to get to kind of the heart of what the community needs from us, maybe asking from us, or how they felt or experienced our care.
Exactly.
Okay.
And you can use it in a variety of different ways. But I think that where I see its initial benefit is in some of our meetings with community groups, that we want to know what their perception is.
Yep.
How we can change the perception, what needs they have that we aren't meeting.
Nice.
And it really is kind of that building of the community, and recognize that we are more than just the building in the middle of the city,
Yeah.
right? I mean, yes, healthcare is business, but we're here for them.
That's right.
And until
And to
we
have a
really,
relationship,
we
right?
have to have that relationship.
Yes.
And we're not going to succeed every time, but we're going to keep blasting all the positives
Yeah.
and making sure that those negatives are opportunities for us to re-engage and do better the next time.
Scott, I have shared on AMC Connects. I'm very excited about this. Cassie, is our executive sponsor to me over, all of this work, and just really excited about that. But this seems like we are ready. Doesn't it feel like we're ready for this level
We
of
are
depth?
beyond ready. And
Yeah.
actually, you mentioned Cassie. It's not just Cassie, because I think when I thought of community engagement champions, one of the initial thoughts that I had is I said, well, there's over 1,000 employees at Rome Health.
Yes.
We're all community champions, right?
Yes.
Because we all live in this community. We all go out we're at the same coffee shops, we know.
Yes.
So I think that we're all champions. So
Right.
the good thing is I have a lot of support from a lot of
Yes.
people.
Yep.
But when you say we're ready for this, and I don't want to minimize any of the other work that some of the other groups are going to have to get to. But there was some voiced concern around it. I hope my administration is going to be accepting to what I want to do within this role. I hope my community is engaged. I feel so confident, not just because I'm part of administration, and but it was just even watching the press release go out the first day that I was in this conference. Everybody else looked and goes, wait, no, we can't yet. And I go, yeah, we can. So the fact that our marketing and public relations is so on top of it,
Yeah.
and that administration and down
Yes.
know about it.
Yeah.
It was interesting because several said that there were employees that didn't know that they'd received the funding. And so I found that is something for us to really kind of tip our hats with, to say that we want the community to know.
Yes.
We want our employees to know. And I can't understand the disconnect or the value in not making sure that you scream from the rooftops.
That's right. Let's go,
Right?
people.
So
Right, let's
the
make it
real
great.
work begins when the real benefit of this program isn't just to have me as a community engagement champion. So everybody in the community that's watching, get ready, because if you're part of a group, you'll likely be being contacted. So get ready for a focused conversation with Scott.
Okay, great. Scotty, is that what that's what's next?
Well, that's what's next. But I
Okay.
think that the real key is, and the benefit of this is the FOA, right? So again, another acronym, that is the Financial and Operations Assessment.
Yes.
I mean, what the work that this group really is doing is helps us, and thank goodness for Nate and operations team, RevCycle, because there is a lot of information that they need from
Yes.
us. And what they do with that is they then kind of pull it all together and put together a pretty significant information pack to say where we are doing well, where we have opportunity, where we could consider making adjustments or adding.
Nice.
So that's really where the community will start to get involved, because we will be able to select a project. Well, they'll tell you to select 3 to 5 projects from that assessment.
Yeah.
And this team will work with us over the next 18 to 24 months
Great.
to determine which projects are going to be the most beneficial to sustain financial viability, but also, most importantly, make sure that we have what the community needs so that we can keep them as our patients.
Awesome. Scott, thank you so
Really
much
exciting.
for jumping into this as only you can. Really appreciate your depth. One of the reasons why I had thought of Scott, and Cassie affirmed that, is his ability, certainly a high degree of intelligence, so always in awe of that, but Scott's willingness to go deep and do the level of work that would need to be done, because this is a new process for us. We have systems and processes. We talked about that on last AMC Connects with Dr. Estivo, that we do a community health needs assessment with the county in partnership with others. But this is a different way, as Scott introduced to us, with some different tools. Well, Scott, the last time you were on AMC Connects, we really didn't get to know you, but judging by every time we launch an announcement about Scott Burns, there's not just like 100 comments and likes. There's like thousands and thousands. Scott, I don't mean to embarrass you, but that is like a lot of fun. But I think people might not know you in all ways. So we're going to do some rapid fire with you, because we never get to talk to you like that.
I'm excited.
Yeah.
Rapid fire.
Okay, well,
Jeez, I can put my notes away for that.
Yes.
No, I don't know.
One of my favorite rapid fire questions is, what's your favorite go-to gas station snack?
That's, boy, that was not what I was expecting. I'm going to have to say Slim Jim.
Oh, nice.
I
Nice.
think
That's
I'm a
enough.
Slim
That's
Jim.
3,
Tabby,
right?
Yeah, Tabby she was like something like that. Yeah.
Yes, yes.
Yep.
Yeah, beef jerky.
Yep, beef
Yeah,
jerky.
she was
Oh,
beef
yeah.
jerky. Okay.
jerky.
So,
Okay.
like,
Yeah,
look,
all right.
look at how connected we all are. Okay. Now, another one favorite for me, for you in particular, but what's your secret hidden talent?
Oh, hidden? Ooh,
Yeah,
I don't hide many of them.
Nobody would
'cause I
know.
don't have enough to hide. Let's see. So a secret hidden talent.
Yeah.
It's that secret.
It's really that secret.
I know.
I would say it only applies to children, but it's getting my way with my kids, with them thinking it's their idea.
Oh, that is excellent.
Yeah,
I mean, that shows.
that's
the level of
actually
depth
that
of
is my
intelligence.
now it's not hidden anymore. But they won't watch this. I'm
Wow.
confident. So
You never know.
But yes, I do have
It's
a way
catching
of
fire
getting
here.
what I want from them, but
Nice.
they think it's their idea.
Scott, this is
And you
excellent.
can extrapolate that to other places in life. So I'm going to work on
Yes.
that. But that would be my hidden talent, is getting what I want with somebody else thinking it's their idea.
Okay, I feel like I know you that much more. Last one. Have you ever won a contest?
Oh, geez.
I feel like you have.
Well,
I have
we
not.
can call Bowie State a contest, right? Would you? No, radio contest. I've had a few of those ones in my day.
few?
What?
Oh
What?
yeah, I started in Maine at a brand new Rite Aid store, and I remember this radio station. I had 5 phone lines in this pharmacy, and it was doing 300 prescriptions a week. So, I mean, 300 prescriptions a week for any pharmacist out there realizes you had some time on your hands. So, not many pharmacists can say that anymore. But I think I won like 7 times in like the first 6 months that I worked there.
Scott,
I was
that
going
is
to the
awesome.
State Theater in Portland. I got to see David Gray. I got to see a bunch of good
Did
people.
you go to all of them?
I gave a couple to technicians because I felt a little guilty.
Yeah.
You know, as a matter of fact, once I
so
finally got to know them a
you.
little
I love
more,
that.
I wasn't allowed to play.
Yeah, this is
The radio
great.
station did actually tell me that I can't.
Is that? Are you
That's
serious?
a true story. I swear. I ended up being
Chuck,
really
this
good,
is awesome.
I ended up being
This is
good
great.
friends with them. They were really nice, but I was going down every 10 days to pick up tickets, and they asked if I would no longer participate.
You are my favorite
So I did.
response on that particular question. Like Scott told us like 3 other things about himself on that one question that you
It
give
was.
to your technicians. That's wonderful. You're serving people.
I was dialing fast, and I got quick fingers apparently because
and
I
then
was
you were-
dialing so quick in caller 9 every time.
And then you were blocked. You couldn't win any more contests because you were
They
so
asked
successful.
nicely. It's not like they blocked the number.
Scott wanted to kill
Yeah, they didn't block the number because I think that would have been mean. They politely requested that I stop taking other people's.
I'm going to go with you were blocked. Just because that sounds wrong.
Fair enough. Fair enough.
Scott, you're a great sport.
Yes,
Thank
well,
you.
That,
Thank you
I tell you, I'm gonna have to think about those again, and I don't know if Slim Jim's really gonna be my answer. Probably should have said Cool Ranch Doritos. That would have been my second.
Oh, I like that.
Okay.
I like Cool
It's
Ranch
the big red
Doritos.
bag.
Yeah. Oh, yeah. Got to have the big one. Good news. You can think about that a little bit more because we're going to have you back because we heard the timeline.
Yes.
And so lots to update over the next
will.
18 months.
I will.
So
And one other thing that I didn't get a chance to tell you that
Yeah.
I'm gonna do, and I don't want us to be stealing Chuck's thunder.
yeah.
But there were, believe it or not, the first 3 hours of this boot camp, because I don't think they realized that I had the likes of Chuck and Cassie, because they're teaching me how to do social media posts,
Yeah.
TikToks.
Yes.
I'd never done one. So I did. Yeah, this was part of the conference, believe it or not.
Oh.
But I did get a new mic. I got 2 mics and an attachment that they gave me so I could do patient testimonials.
Wow.
Which I'm going to plan to start to do. I think the one that I was thinking about the most was I knew how excited somebody was to get back and get gardening.
Yeah.
Well, they were discharged and got to get back and get gardening. How great would it be to go there and
Yes.
see them and have that patient testimony?
that's awesome.
So it's little things like that that I think that this grant's going to kind of help us think about is how we do market ourselves even better than we already do. I think we've done a lot. But to have somebody outside of the marketing team do some of the testimonials, I think will be nice. Because it's all really is. If you really think about it, it's about care. It's care when you need it, where you need it.
Yes.
Right? So when you get an opportunity to have that one-on-one with somebody, it's not always ideal to bring them back to the hospital.
Yes.
Meet them where they are.
Yes.
I think that was a good message that I took away from there was to recognize that our community is our community. We should meet them in the community, not ask them to come to us.
Yes. Referencing Scott, everyone, excellence will be as we go into the future, meeting the community where they are. And another takeaway point that I think Scott was brilliant on is it's not just Cassie, it's not just Chuck, it's not just Scott, it's all of us. Like we have over 1,000 people that work within our workforce, and we're all the champions, especially when it comes to community engagement. Thank you again, Scott, for
No
being
problem.
with
And
us.
Chuck, if you wouldn't mind, you're welcome to put my name and number out so that anybody that does listen to this community-wise that's interested in being part of this community push can reach out to me directly.
Oh, please,
Will do.
please. What a great, wow, that
Put
is
it in the mailbox.
Yes, put it. Yeah, the
Send us a mailbag.
The
Yeah, put it in the
mailbag.
mailbag.
everyone.
That's my shameless plug.
Thank you, Scotty. This is great. Well, as we close, everyone, and as promised, we did have an opportunity to be at our Rome Health 2026 Gala recently, and what an amazing event. Thank you to Chet DeBerry and Julia Reed for organizing like a best ever event. Just really unbelievable day. I think we had the participation rate was one of our highest, if not the highest. And I was just saying to Chuck before we were casting this episode that there were subtle, amazing changes that were done, and the engagement was just the culture and the vibe in the room was unbelievable. And it was so much fun. Thank you to all the employees that carved out time to go. Thank you to community members who sponsored and took the time to be with us. It was a wonderful celebration. The foundation packages Roma Health up so beautifully. I do want to close with a sincere thank you to the workforce that stayed behind and made sure that our patients were taken care of while others got to celebrate. So I'm so grateful for our weekend, evening, night shift workforce that does a beautiful job, again, while others were doing other things in the community. So thank you all for creating the best care out there here.